This medication is used to relieve mild to moderate pain and reduce fever. It can be used for various types of pain such as headaches, menstrual periods, toothaches, backaches, osteoarthritis, or cold/flu aches and pains. The usual dosage for adults is 325 to 650 mg every 4 to 6 hours as needed, with a maximum dose of 3,900 mg per day. It is best to take this medication with food or milk to prevent stomach upset. Be sure to follow the instructions on the label and consult with a healthcare professional for the best timing to take this medication. When taking acetaminophen for arthritis pain, it's important to follow the dosing instructions on the product package. Make sure not to take more than the recommended amount, and if you're giving it to a child, use a product specifically meant for children and follow the dosing instructions based on their weight or age. If you're using a liquid suspension, shake it well before each dose and use the provided dose measuring spoon or syringe to ensure you're taking the correct amount. For rapidly dissolving or chewable tablets, follow the instructions on how to take them properly. It's best to take pain medications at the first signs of pain, and not to wait until the symptoms worsen. Be sure to consult your doctor if your condition lasts or gets worse, or if you develop new symptoms. And if you think you may have a serious medical problem, seek medical help right away. If you experience any unusual effects from taking this medication, be sure to contact your doctor or pharmacist right away. Your doctor has determined that the benefits of using this medication outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. While it is rare, a serious allergic reaction to this drug can occur. If you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And if you're in Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to be cautious when taking acetaminophen for arthritis pain. Adults should not take more than 4,000 mg, 4 grams, of acetaminophen a day, as taking too much may cause serious liver disease. If you have liver problems or if you're giving acetaminophen to children, you should take less and consult your doctor or pharmacist for the appropriate dosage. Be sure to check the labels of any other medications you are taking to see if they contain acetaminophen, as it is a common ingredient in both non-prescription and prescription drugs. It's important to avoid taking multiple medications containing acetaminophen without consulting your doctor or pharmacist first. If you accidentally take too much acetaminophen and experience symptoms such as nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, or dark urine, seek medical help immediately, even if you feel okay. Daily alcohol use, especially when combined with acetaminophen, can also cause liver damage, so it's best to avoid alcohol if you are taking acetaminophen for arthritis pain. Before taking acetaminophen, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a history of liver disease or alcohol abuse. This is especially important if you are using liquid products, chewable tablets, or dissolving/effervescent tablets and powders, as they may contain sugar or aspartame, which could affect conditions like diabetes or phenylketonuria. If you are pregnant or breastfeeding, it's also important to consult your doctor before using acetaminophen. Now let's talk about the potential interactions of arthritis pain medications with other drugs. It's important to be aware that these medications may change how your other medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with arthritis pain medications are ketoconazole, levoketoconazole. It's also important to note that arthritis pain medications may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this medication. It's best to take this medication at the recommended dosage and at the optimal timing as advised by your doctor. If you or someone you know has taken too much of this medication and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the skin or eyes, and dark urine. Unlike NSAIDs, such as aspirin, ibuprofen, and naproxen, acetaminophen does not have the potential to cause stomach and intestinal ulcers. However, it does not have the ability to reduce swelling like NSAIDs do. It is important to consult with your doctor to determine which medication is the best option for your arthritis pain. It's important to note that acetaminophen is not a suitable replacement for NSAIDs in all cases, and consulting your doctor is essential in finding the right medication for you. If you forget to take a dose of this medication on your regular schedule, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next one at the usual time. Don't take extra medication to make up for the missed dose. It's important to store arthritis pain medications at room temperature, away from light and moisture, but not in the bathroom. Keep them out of reach of children and pets. Also, do not flush medications down the toilet or pour them into a drain unless instructed to do so. Always properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.